is that high peaked curve which was predicted for no mitigation, and we can pretty much assume that we're never going to get up to those peak levels. But what we're looking at now is the flattened curve that was predicted for us with mitigation, and that has now become the red line, and our actual curve has become the green line. We kind of swapped the two colors because it seemed more intuitive to say that the red line is the line we're still trying to not approach. The green line is our actual number of hospitalizations over time, and we have crossed below our red line. And so that gap in the line is where we are right now, but if you were to follow your eye out to the right, and if we were to stay straight, that is our forecast, would be to just kind of be flatlining. This is the same information as far as the red and green line graphed out. The blue line has now been swapped for just the number of confirmed COVID cases, which of course continues to go up the more we test. But as everyone knows here, importantly is the number of hospitalizations. And as I said, it is remaining flat, which is very, very good news. Again, the numbers are really tiny to see, but if you look at the very right-hand column at the bottom, our most recent dates show that our increases in hospitalization rates are quite minimal. And that is depicted here. We can see that the current 3-day moving average is 0.7%. And you may recall that I had said in a previous meeting that we would be looking at these 3-day moving targets. And if we ever increased by 2 to 3% over 2 3-day moving targets, then I would have to consider going back on some of the restrictions that we had lifted and being strict again. However, you can see that we don't have the need to do that at all at 0.7. It's very, very good news. And the largest peak that we ever had was back on March 23rd, where our 3-day moving target was at 4.7. So I'm really looking now to see that we don't approach that number. It doesn't seem that that's going to happen. Of course, the governor did on May 8th open curbside retail and some manufacturing and logistics, and time will tell whether that's going to affect this number, but I'm hoping not. So that was just a very quick overview of the latest models that we have. And we do have our roadmap to reopening and recovery for COVID-19 specific for our county as well to present. And I'll just start by saying that the very beginning of this roadmap now has embedded in it the attestation metrics that Director Blackwell-Rodriguez just went over and that Mr. Miles had covered at the beginning, but just reiterated again so that we can show the public and show the board in numbers exactly where we stand right now. So this basically says that on April 14th, Governor Newsom set forward 6 indicators, and then on April 28th, he developed a resilience roadmap for the state, and then on May 7th, he then put out attestation criteria. And it makes it clear that if we are not a county that can attest and we don't meet the metrics, we still move forward through stage 2 and stage 3. It's not that we're stopped in time, but we're moving forward with the governor, with the rest of the state that do not attest. The attestation criteria have been called variants to stage 2. So basically the metrics that were presented earlier as far as our prevalence and our testing capacity, and our ability to reach most of the population with testing and with contact tracers, all of those criteria are criteria to attest to accelerate through the rest of stage 2. So to make it clear, on May 8th, last Friday, the governor announced that we were moving into stage 2 as a state together by opening up curbside retail and associated manufacturing and logistics. So we all entered stage 2 together on May 8th as a state. There were some counties in the Bay Area that were stricter and decided not to move forward on May 8th with curbside retail, but we did follow governor's direction and took that opportunity to move into stage 2. Now, the rest of stage 2 includes some things that are very important, like dine-in restaurants and other things that have been mentioned by the governor and that are on his website. And it is the attestation criteria that will allow us county to get to the rest of stage 2 faster than the governor has set. I don't know what his timeline will be. He's talking about weeks. So even if we can't attest, he's talking about weeks, not months, for moving through some of the other phases of stage 2. So I will just go on here to go through some of the things that have already been discussed, and I'm sorry that this is probably really small for the public to see, but basically the prevalence data, the epidemiologic stability for 14-day period, as we had said, we needed to demonstrate 1 COVID-19 case per 10,000, and in the last 10 days, we've had 92 cases confirmed of COVID, and with a population of 762,000, we need to have 76 cases or less in a 14-day period. So we're now at about a 1.2 COVID-19 cases per 10,000, trying to reach that 1 case per 10,000, and not quite there yet. And we did already say that we've had some deaths, and our latest death was on May the 8th. We did have a string of deaths before that on May 2nd, May 5th, May 6th, May 7th, and May 8th, so almost daily we've had a death. And so obviously very sad and concerning, and one of the reasons why we can't attest at this time using these metrics. But if you use May 8th as our last death, the earliest that we could submit for attestation would be 14 days forward, which would be on May 22. Protection from stage 1 essential workers. I know that this was already reviewed, but just want to show you that this roadmap shows the attachments to the social distancing protocols and Appendix A of our order, which we believe show that we do meet that criteria. This is something that Director Blackwell-Rodriguez showed on our dashboard, which was that we do meet the daily testing capacity of 1.5 per 1,000. Which means that we need to show that we have the ability to test 1,114 people per day. And when we did poll all of our local testing facilities, we learned that we are able to do 2,029 tests per day. So on the dashboard, that was that circle with the arrow showing that we have met that number. Also, we need to demonstrate that the county is able to test 75% of residents within 30 minutes drive time in urban areas and 60 minutes drive time in rural areas. And that map is tiny, but I just wanted to show it to you. This is the map that was shown on our dashboard, which shows the green and the purple, showing 30 and 60 minutes drive time for 75% of our county. And anybody will soon be able to access this on our website as our new dashboard. So that also is a criteria that has been met. We talked extensively about contact tracing, so just wanted to show you that in writing. And then again, hospital capacity, the graph that is from our EMS agency shows that we have met 35% surge. And I do have here, as part of our triggers for adjusting modifications, the graph that I just showed you from Bayesian, which shows the trigger that we're going to be using for adjusting modifications. So that was just quickly an overview of what was added to the roadmap. I think in time, if we have a version 5, version 6, we will just be attaching the link to our dashboard because, as you know, this 14-day target for prevalence is a moving target. So instead of showing it in terms of real-time numbers that are kind of frozen in one time, we will just put the link to the dashboard to show what our 14-day moving numbers are. And Director Cunningham could probably speak to the map as well, the roadmap as well. Sorry. Thank you.
Okay. So on the next slide, it represents stage 2 and what's not permitted in stage 2. So the early stage of stage 2 was, as we already noted, which has happened, the curbside, retail, manufacturers, and logistics. What wasn't permitted was, of course, the personal services, such as nail salons, tattoo parlors, gyms, and fitness studios. With what we want to be able to proceed more quickly through without waiting for the governor's orders is to expand into stage 2, where we could do destination retail, including shopping malls and swap meets. What stage 2 does not include would include the entertainment venues, with limited capacity, such as movie theaters, gaming facility, and pro shops. Personal services, we are looking to be able to proceed quicker through those, limited to car washes, pet grooming, tanning facility, and some expansion on the landscape gardening, although we do allow for some of that today. What it doesn't permit is like indoor museums, kid museums, gallery spaces, zoos, and libraries. We would look at expanding into office-based businesses, dine-in restaurants, and other amenities like bars and gaming areas would not be permitted. We didn't get to hear the governor's information today, but there may be more that came out today as it relates to the dine-in restaurants. It would not permit community centers, including public pools, playgrounds, and picnic areas. In the governor's stage 2, where we would look to advance quicker, it would include outdoor museums and open gallery spaces, looking more closely at the schools, and reopening and child care. What's not permitted is limited capacity of religious services and cultural ceremonies, nightclub, concert venue, live audience, sports, festivals, theme park, hotel lodging for leisure and tourism, non-essential travel, and higher education. If we go to the next slide, we're to the point where we're at the stage 2 towards the bottom of the page there, where we're looking to ask to reopen some of these lower lists by submitting our variants and that we meet some of the criteria, or at least have a justification. For example, how we said with the homeless, have hotels lined up that if there were COVID positive, we have a plan in place that we could react to. What stage 2 doesn't do for us is it does not allow us getting this variance, submitting our criteria, is doing some of the things that are listed on stage 3 and stage 4. Stage 4 obviously is everything's reopened. Stage 3, though, allows for reopening of higher risk workplaces which require close proximity to other people, and that's the personal care, hair, nail salons, gyms and fitness studios, in-person religious services, and entertainment venues with limited capacity, the movie theaters, pro sports, gaming facilities, which I had referenced on the other page. Now, where I don't know if there's opportunity and we could submit it is where we have some modified versions, and I'll use from the religious perspective. Recently, some of the requests that are coming in is to be able to provide communion and have a written up protocol. And I will say there are a lot of thoughtful protocols as it relates to religious, some of the sporting type events, even where they could do it without having spectators. There's a lot of requests as far as sports and youth go. Again, some of those that are modified that you could, where it really maybe does fall into a lower risk, we could potentially attach those and ask for some of those variances, but they're not typically what's included in the stage 2 variance and moving forward. So taking everything that we heard today, we pretty much have our requirements and the validations for the criteria. I know that Dr. Park has a phone conversation that must take place with the CDPH, and that's going to take place tomorrow. We do need something in writing from this board that shows that we have your support in moving forward based on the criteria and what's happening. We need letters of support from our local hospitals and healthcare systems in regards to what we're submitting. We'll share tomorrow with the MAC group what we've talked about here today. I have not heard in any of our previous calls that anyone is not in favor of doing this. But again, we will share with where we're at and what we presented today. We've heard also that there's in process potentially a regional letter from the Central Valley counties that we will watch, and if there's opportunity for us to be part of that, we can become part of that letter that would also go to the governor. Again, the more that you can show in support of, they like to see that there's this connection with other counties in relationship to this variance in the work plan that would get submitted. And then once through the conversation, and I think through that conversation, some of the detail of what we can do to meet the requirements, if they're a little bit far-fetched for what we are as a larger county, we can provide that documentation, and it's open for opinion. And again, I've also heard that they're looking to just make sure we're doing what it takes in order to meet the need if the need arises in certain situations. And from there, I guess we get an approval of some sort to proceed.
So yes,
but that's done on Dr. Park's part in working with the CDPH.
Thank you. Yeah, and I got the impression it's not like we're actually going to get an approval. It's more like we're not going to get a disapproval, right? It's sort of,
that we need to get some clarity on the actual process. It has been made clear by Dr. Angel, the state health officer, that the state is not going to be authorizing our attestations or approving them. However, you do have to make this phone call with the state. You have to notify the state that you have an intent to seek variance. This is why we have a phone call scheduled for tomorrow to show them that we have an intent to seek variance. Although, as we showed you, we don't meet the metrics at this point in time. The phone call is also to seek technical assistance. So for questions where we find that maybe we think that we can kind of move around the terminology and ask for some grace, that is the purpose of this call as well, is to see how they're willing to work with us. But the message that we're hearing is that once a county can attest, you are to submit this to the state, and you are to put it on your own personal website, and the state will put it on their website. And the understanding that some counties have had who have already tried to get through this process is that they don't consider themselves technically ready to open through the rest of stage 2 until the state has posted their attestation on the state website. So that's what I'm reading. I believe about 10 counties actually have already attested. They've already met this measure because they've had no deaths or hardly any COVID at all to begin with. Really, those were the counties, for which this form was designed. For rural counties that have hardly any COVID, they pushed for this. And so larger counties like us, we're going to have a harder time making attestation. But of the 10 counties that have already done their attestation, I don't know of any that have actually started to move through the rest of stage 2 because they feel that their signal to be okay and do that is when the state puts their attestation up on the website.
Right. And I understand that we're not there on everything, but I do think from what we heard today, we're very close on many of them. And I also believe that we have a very strong case to be made even on the epidemiology end of it, because we did use Bayesian early, we have been tracking early, and we have very strong metrics to look at. They may not be exactly what the numbers they're looking at, but I believe they tell a really strong story for what is actually happening here in San Joaquin County, and I think that should strengthen and bolster our case. We have a few questions here. Supervisor Patty?
Thank you, Madam Chair. With the intent to meet variance, and I appreciate the hard work you guys have all taken to have this ready at this point. I know you're not just getting started. You guys have worked weeks in advance to do what you could do to be ready for that discussion and that submission to the state. That said, so with that discussion, is that a decision, or what's the timeline process to get permission to go into this phase 2 to a deeper degree?
That's exactly what I was saying, is that I believe that there are some counties that have already started the process of attesting but have not actually moved through to other stages of stage 2. So it's unclear to me, and this will be a question that will have to come up on our call tomorrow as we ask for technical assistance.
Okay, but as heard for an hour of our public comments, people are asking to open, and they're really at the, I think the end of their line. So a lot of desperate measures here for business owners and for employees that are unemployed. What would be the next phase? Okay, let's say we go into phase 2, and it's still noting there's no inclusion of hair salons or personal care, and that's a very big part of our economy. There's business owners that are paying rent for empty storefronts that have no economic activity. There are multitudes of people that work in these locations that have no income coming in, and they don't get supplements from the government. So what's our timeline, or could they be included in our plan to be part of phase 2?
So if you look at the roadmap, the way that we have stage 2, 3, and 4, we decided just to put the items in the stages that we clearly have received guidance from the state. There are many things that were in here before that we removed because it wasn't clear from the state whether they were stage 2, 3, or 4. Some of the things that just say permitted in stage 2 but not permitted in stage 2. If it's not permitted in stage 2, does that make it a 3 or a 4? If it wasn't clear whether that was 3 or 4, we didn't put it in our stage 3 or stage 4. So this list is obviously not exhaustive, but it's all we could find from the state, so the safest thing to do. Now, the state has clearly said that hair and nail salons and in-service churches are in stage 3, and unfortunately, that really is what we're getting a lot of letters on and a lot of demand from the public, and I understand that completely. So the state has said that with this attestation, you are simply asking or attesting that you have met criteria to move through stage 2 faster. So to accelerate through stage 2 faster. So those are the other things like the car washes, the pet grooming, the tanning facilities, which they consider to be non-contact personal care, things like that they have said are in stage 2. You can go through that phase faster, but it does not get you to stage 3 faster necessarily. And so that is a language I'm hearing from the state. I have heard different things. I've heard that we are still on a path to enter stage 3 together as a state, no matter how fast you accelerate through stage 2, but I'm not sure if that's clear. But those things are in stage 3 according to the governor. As Director Cunningham said, though, we can make our attestation what we want. We can say that we attest to meeting these criteria, and then at the very end piece of our attestation, we need to have an exact plan as to what we plan to open by attesting. So the language might be something that could be sort of played with, and so that is something that I'll have to discuss with the state as well. Something that's not on the roadmap was that very last factor. So the last thing that is on the roadmap is our trigger for modifications, but the very last point, which is not on the roadmap, is the actual plan, which needs to be a detailed plan saying how you will move through stage 2. But it clearly says how you will move to stage 2, but not including stage 3. So it would have to be an ask to say that we want to put some things in stage 3 into this attestation. I don't really want to blow our chances for attesting if we qualify, so I don't want to put too much in there, but that's still a conversation that we need to have. And
if in that conversation you discover there's the possibility for more flexibility and more discretionary opportunity, you would be able to include that if that wouldn't be outside of your purview, even though it's identified for stage 3. I know there was perhaps a speech today from the governor that may have opened up the window for something additional, but I know that our economy and the people's well-being is at risk here, and we need to be doing everything possible, as I know we are all very much attuned to this issue. But we need to push the parameters as much as possible. People's lives and livelihoods at stake here. Yeah, understood. I think it is safest to simply ask to move through stage 2 at an accelerated rate, because that is the purpose of this attestation, and then to take on stage 3 as a separate burden and as a separate cause through letters to the governors, through asking our business people to send letters to the governor, through different discussions. So we will see. At this point, as I said, if they keep the prevalence criteria there, we don't make it until May 22 anyways, and at that point the governor might be moving
the state forward with other measures even before we can attest. So it might actually be faster to move with the governor than to try to chase the attestation metrics. So time will tell, because I don't know what he said today, and I don't know what he plans to say as far as moving the rest of stage 2 forward.
Understood. The biggest, I think, the biggest challenge for people is they don't have hope. They don't have an idea. They're left in limbo, and that uncertainty of when will this end there is no answer. And they can't plan for it. They can't borrow money for it. They can't have any idea of when that end is. And this is just a, open frustration that we all experience, but in particular, those that are unemployed and those that are, suffering financially. And this is something that it's all too vague. And that's something that we here are held hostage to, depending on what's coming out of Sacramento. So I'm just, voicing what I know I'm hearing, and, Supervisor Elliott pointed out, Supervisor Wynn pointed out, I know Supervisor Villapudua and I pointed out, I did a little bit of a rally on Saturday, and as we just all know, everybody is looking to us, and we're looking to Sacramento. So I appreciate the efforts that we're taking in anything we can do, and whatever we can stretch in the boundaries of would go a great, it would have a great big impact. Anything additional we can include. Thank you.
Supervisor Villapudua.
Thank you, Madam Chair. Dr. Park, I'm just curious, we've been working with the Dental Association, and I guess yesterday Stanislaus County opened, and they're asking in what phase can the dentist start get back to work?
So the CDPH released guidance on May the 7th, allowing dental practices to reopen for routine care. So this was the signal we were waiting for from the governor, and it came as a guidance document from the California Department of Public Health. It wasn't a big announcement, and I wasn't aware of it before it happened. And this is what we were saying all along, was that the California Dental Association was waiting for this signal, and it did come on May 7th. So dental practices are reopening with guidance. And the guidance is clear in that they do expect that dentists to have a proper amount of PPE on hand, and that they're screening their patients ahead of time for COVID symptoms or COVID exposure. Dentists have, at their own discretion, the ability to stay closed if they want to, or to move forward. They are discouraged from doing aerosol-generating procedures, but most preventive care where you don't generate aerosolization are allowed, and so they have been given the green light.
Oh, great. Now then, how about who oversees convalescent homes? Do we do routine checkups or anything?
So there are various types of homes throughout the state. There's assisted living homes, there's skilled nursing facilities, which require more of a nursing level of care. There's elder care homes, and then there's homes for children. And they all should have their own medical directors. Any facility has its own corporation and its own director that's overseeing it.
I just had this conversation with Dr. Ernie Basti, and he was telling me that basically majority of these senior living convalescent homes should have some input. Because I guess in Turlock they had a big outbreak of COVID, and he was asking me if we could somehow the county can get involved and do some sterilization of their PPEs. And I told him I'd bring it up and get your thoughts on it. That's all I'm doing.
So as Director Blackwell Rodriguez said earlier, we do have a SNF team, a skilled nursing facility team that we put together at Public Health for the purposes of COVID training, and they have been reaching out to our skilled nursing facilities to make sure that they are trained in isolation, in donning and doffing PPE, and in disinfecting their homes, so that there's a team that has been doing this already.
Great. Thank you very much.
And I just wanted to clarify that they are overseen by the Community Care Licensing Agency of the State Department of Social Services.
Oh, great.
That's who licenses the facilities.
Thank you.
Thank you. Supervisor Wynn?
Thank you. I appreciate all the work that you've done. I think we are making progress. But I have a real problem with this whole process. And I know I've spoken with you, Dr. Park and Ms. Cunningham. I mentioned probably about 6 weeks ago in dealing with another state agency for over 5 years in implementing a particular legislative order that was passed or program. I found that the state was ill-equipped to understand how to proceed, and by virtue of our collaboration with San Joaquin County and our partners, various water agencies in the cities, et cetera. We were able to work together and move through that process and educate each other. So it was a partnership. In this particular case, I'm really troubled because, the numbers you look at, for example, they're all round numbers, 1,014 days. I can pick numbers out of the air. It doesn't seem to me there's any research to verify these. Maybe it should be 550 in 5 days or 7 days or whatever. But it's just we just throw these things out from a governmental level. And the other part of it is we keep looking at models and we're operating from basically our premise from the beginning as to the contagion and I guess the potential risk of COVID-19. There is plenty of information out there now from a variety of states that implemented, probably over 2 weeks ago. I remember Georgia the governor was just lambasted even by the president because they were having tattoo parlors and barbers and things like that. They went the whole hog. Restaurants, bars, they opened the state up. And I remember everybody said, well, it's the doom. I mean, they're going to have this tremendous outbreak, et cetera. I haven't heard or seen or read anything in regards to any kind of resurgence of the pandemic. And then I don't want to go into it, but if you look at the numbers in regards to ratios as far as hospitalizations, deaths, et cetera, and you look at Texas and you look at Georgia and you look at Oklahoma and you look at Florida and you look at Tennessee, and I mean, you can go down the list of states that have opened far more than we have, and our numbers are almost the same. In fact, in many cases, our numbers are lower than those states, and yet they're moving forward. So my question is, what's wrong with California? I mean, do they think that the population is stupider than the rest of the United States? Because they're basically restricting us and the majority of the population, the vast majority of the population, from really making intelligent choices as to how they want to conduct their lives. And so I think, I'm just frustrated because we keep tinkering with the state's guidelines in regards to, phase 1, phase 2, those stages, et cetera. And nothing changes. I mean, obviously we make some headway and we're moving into this. The attestations, I understand, are in place to make sure that if something happens, we can deal with it, from a medical standpoint. But there's almost no discussion other than the rallies and the protests about the economic development. And the fact of the matter is that, that's a critical component. And to be honest with you, and is that public has gotten to a point where they no longer trust government because they just see a bunch of bureaucrats making decisions, and we've become part of that, obviously. But the reality is I know, Ms. Cunningham, you have a lot of information in regards to just some lengthy lists of criteria that businesses have offered that they would follow if they're open. It doesn't make any sense. Because I've talked about, and I think Ms. Nino sent out, the John Hopkins, and if you read that, it makes sense because it's the duration of the contact, the frequency of the contact, and the mitigation measures that can protect from higher risk. It's not just, let's throw it up against the wall and see if it sticks. It's basically, you actually sit down and look at a business and decide, what do they do? What happens in that business, and how can you protect the employees and certainly the public? You take Costco. Well, what does Costco have? They have plexiglass shields, okay? They have marks, and so you have to be 6 feet basically from cart to cart, et cetera. They've done those things. They have minimal contact even before the plexiglass shields, but they have high volume, but they've done mitigation. So what's the difference between that, where literally hundreds, if not thousands of people go through that business on a daily basis, touch a whole bunch of things, ungloved, and until, before Monday, unmasked, and yet a business, a small business in downtown Lodi or Ripon or whatever, they can't open their door. They can't allow people, maybe the most, maybe 50 or 100 customers a day, to buy things in there that they're buying at Walmart, so they have no revenue, et cetera. So my question is, there's no sense to this. It just doesn't make any sense. and whether it be Home Depot and you line up to the street, because you're distancing before they let you in, then you walk through and people sometimes social distance, sometimes they don't. But so what's the difference between Home Depot and any other? Ace Hardware in Ripon, the parking lot's packed. Okay, so there's people all over the place. And yet we have these really stringent guidelines in regards to these businesses. And my question is, first of all, it's not fair. It's probably unconstitutional, and there's a lot of people challenging that. So I guess my thought is, as opposed to just, telling the governor, you need to reopen, things like that, I think the governor needs a taste of reality, and I think the governor needs from us, just maybe me, to send them a letter with, based upon our look at Johns Hopkins and the criteria that they lay out, we have looked at businesses and we made the determination based upon duration, frequency, and mitigation. These are businesses that we can open in the second stage or whatever. And when you look at I was looking at pictures of Yuba when they thought they were open, barbershops and nail salons and almost everything you can think of. I've seen pictures in Colorado of businesses that opened on Mother's Day that were packed with no masks, etc. People are just willfully disobeying, and as far as trying to maintain any sense of control, we're losing it to a point where people are just going to say, I'm going to do what I want to do. The only problem is, for example, I asked my wife if she wanted to go out for Mother's Day. I said, do you want to go to Costco, Home Depot, or a liquor store? That's basically, the choices you have. So my point is why are we continuing to play this game when in fact we need to go in a totally different direction to educate the governor or his staff or whatever? And I understand they may just blow it off and say, hey, you're all wet, we're not going to do it. But I think our constituents expect us to be proactive and aggressive. And I think, and if you look at the Johns Hopkins, you can look at some of the businesses that are in a different category than what they are by the governor. And the reason I bring that up is because people want at least to know that we've looked at it seriously. We've made some decisions which may be totally different than the governor's. But that's okay. Difference of opinion prevails everywhere. So I would suggest that we take those documents that you have, which I thought were outstanding. I mean, some of those business owners took a lot of time. I mean, there's things in there I wouldn't even think about in regards to protecting their employees, et cetera. And that we list those and we evaluate each one individually. And based upon that, this is our recommendation. Just as a county of people who are trying to get on with their lives and the government that's trying to do the best for their constituents, this is San Joaquin County. And as Ms. Dean will probably talk about, as I would suggest, and I've talked to my group in the Valley, and we've talked about various things, but I think we ought to make it a Valley-wide proposal. And I would suspect that other counties, and I know, talking to other supervisors and elected officials, they're just as frustrated because they see us so confined as to what we can do. And I think they would support a broader approach, a more detailed, and I think, frankly, a more thoughtful approach to businesses. And I think our businesses deserve that, as opposed to just continuing to play this game like ping pong back and forth with the governor. Because with that, as long as the governor, and I know he's got a host of advisors, but I don't think he has people like us, just regular people who see the reality on a daily basis. And he needs to hear from the core residents and not from bureaucrats or experts, so to speak. So anyway, I just think that we need to do an in-depth analysis. I'd be more than happy to work with you. I know you're busy, et cetera, but I think we can come up with a pretty good list with justification. And I would throw in the other states that are doing things and nothing's happened. So again, I think we need to do something. And if you're not available, or maybe your staff, it doesn't matter. But I think that I don't want to do it by myself, because that's an idea of one, and you really need at least a small group. Because I think that if we're going to send a letter, that I think it needs to be very aggressive, very pointed in regards to what we expect. And I think even if it doesn't go anywhere, I think our constituents would appreciate that we made every effort to get them back to work, and I think that's probably the goal of this body. So anyway, I just leave it at that. But again, thank you. And one last thing, and I was just going to ask you a question because I was listening to our district attorney. Do you think there's any connection between homeless and the lack of identification of COVID-19 and herd immunity? Because, they're in situations where they are exposed to a lot of different diseases over the years, as we've seen in the encampments. Have they developed a stronger antibody immunity than the rest of us because of their environment? I'm not picking on them. I just asked the question.
I haven't heard of any research in regards to that, so it's a very interesting question. From a scientific standpoint, this coronavirus is new to everyone, so nobody really started off with any immunity. But, you always hear about people saying that you should let your kids play in the dirt so that they build up their immune system. So it is an interesting question. We're just really fortunate that we haven't had any outbreaks in our homeless community. And I'm very thankful for District Attorney Tori Verber Salazar's presentation.
Right.
The words that she used are very powerful, and it might be something that we can put in that part of the attestation, because it really shows that with the work of the Homeless Task Force and the DA's office, they really did curve what could have been, a terrible outbreak early on. So I think I'm going to use some of her wording in the document that we're going to be building.
Well, I agree with Chair Miller in regards to, the interpretation and the application of this as opposed to trying to follow the fine point. One last comment I touched about it briefly, but I really think the county needs to partner with our hospitals and our medical clinics in regards to getting people to come back. I know somebody that went to the emergency room in Manteca on Sunday. They were the only patient. And if you go to any emergency room in any time, especially on a Sunday or a weekend or whatever, they're packed. And we need to, and I think we have built up this tremendous fear in the public, to either seek medical care. When you talk about dentists, I would also offer, it isn't just routine care, because there are things that may need a root canal, that if you don't get the root canal, you may have an extraction. I mean, there's things that need to be done more than just cleaning your teeth. So again, I know you're not dealing with that, but see, that's somehow the frustration, because sometimes I think that the state only looks at things superficially, and they don't dig down into what happens if you don't take care of things as opening businesses, because there will be a devastating impact upon our residents. So.
And let me be clear, I hope that my comments were not offensive to any of the homeless population. I'm just trying to answer your question, Supervisor Wynn. I'm not trying to imply
I'm not,
they should have increased immunity based on...
I don't think your comments, and I hope nobody takes my comments to mean it's just a question, because, and I know part of it is certainly work Supervisor Miller has done, and the district attorney's office and her team. So it's a joint effort, and I think our residents here are up to the challenge of making it work, no matter what it is. In fact, I think they look forward to the opportunity to participate in their future, as opposed to letting government just pretty much lead them down the path. So again, thank you, Madam Chair.
Supervisor Elliott.
Thank you, Chair. We've had lots of good comments today here, and lots of good ideas on how we can approach this. I'll go back to what I said a little earlier, that everybody's concerned about making sure that we follow the science and the data, but we can't forget the common sense application of what the data says, and the common sense application of the methods that we are using. I know Dr. Park and Director Cunningham have both talked about the attempt to inject common sense into our approach to these things. So I'm thinking when we make our presentation, have our discussion with CDPH, when it comes down to attestation, and in fact when you prepare your letter, we can certainly attest to having met some of the specific criteria, but on the others, if we haven't met the specific number, I think we can make a case for saying we have met the spirit of this roadmap to reopening in terms of protecting our population and doing it in a responsible manner. And I think from the comments that we've heard over time, and especially today, they seem to crescendo as time goes on. People are ready to get back to work. And I'd just like to highlight one of the comments that we heard today. So that the greater good is served by reopening our county businesses, our churches, our services. That's what we need to be focusing on. There will always be viruses. There will always be risk. We just have to be able to do what we need to do in a responsible manner. There's no way we'll ever provide absolute safety. So we need to look at meeting the greatest common good. So let's try that as well to attest to the spirit of the reopening.
Well, yes, we are trying, Supervisor Elliott. Some of the measures are so exact that, for example, the deaths are so exact that there's no way of saying that we meet the spirit of that. So, but where we can kind of say that we meet the spirit, such as with our homeless numbers, I think that that's a good idea. That very first measure of no deaths for 14 days is a tough one. We still have sick people in our hospitals right now. And so I don't want to downplay the fact that there are still people dying in San Joaquin County. I do understand the need to reopen from an economic standpoint. And I understand that is the majority of people who are not sick, but the governor does have, for whatever reason, his own experts weighing in on this, and this was the measures that we were given. So we will do our best. As far as this first stability measure, with the prevalence rate being 1 per 10,000 and no deaths in 14 days, that is something that I think as a region we're looking at to appeal to the governor. So I might have more on that by next week, but I know that in our San Joaquin Valley region, we're having talks about trying to appeal to the governor's side on that by saying that we're really our larger counties than what this measure was built for, and we're not going to stop having deaths very soon in the near future, as we still have some really sick people in our ICUs. So we're trying to ask for a difference of variance metrics, and we'll see how far we can get with that.
Great. Yes, I think, and we need to appeal for a different metric in both the number of deaths and the number of cases as well.
So listening to the feedback from everyone, from my perspective, what I will work on is I have taken all the feedback that has been supplied to me from the board member, from contacts you've received. Some of those individuals I have spoke directly with. I will tell you I've been very forthright and honest with them about where we are, where we would like to be. Could not commit to promises, but could commit to where we were in the process and trying to get there. What I can do is put together what was asked as far as, again, it's not a light switch necessarily that everyone's asking for. Some of this is a dimmer switch, and some of these other categories that we're seeing in stage 3 is maybe put together that list. I know some of our cities even had very thoughtful plans and processes for their businesses, and put that together to share out with this board, and we could talk about it, Dr. Park, and maybe getting outside a little bit of the governor's stage 2. At a minimum, we want to do this, but ultimately based on, we also want to show the supporting documents from a low risk perspective. Here's some alternatives as how we can do some of these other items that start moving that progress for them in getting to where they're more reopened than not open at all. I think there could be opportunity. I can work on that. I've created folders for every single category of gyms, churches, sports, you name it, it's there. I can work on that piece and certainly share it out while you're busy doing probably the more difficult part of what needs to be put together here, and then anything else that you need help with. And there are several people that I did commit to calling back. I will be assured to do that as well. And I also, in speaking with them, have encouraged them to go to the governor's website and submit what they're looking for, submit their proposals, and even have done a few of them for the individual, with their permission, of course, and we'll continue to pursue that avenue as well as some of that comes forward.
Madam Chair, if I could, well, we have Dr. Park and Director Cunningham at the staff table. If we could possibly discuss a few of these correspondences that I've shared with you, but also shared with the board last night, especially the one that Butte County drafted, and that is that Valley, somewhat of the draft letter, Dr. Park, that I know the public health officers have had a discussion of the San Joaquin Valley, putting something together jointly. We've been informed that Stanislaus County is drafting that document, and we should be able to see that later today. And that's something similar to Butte, but it won't address the uniqueness of San Joaquin, which I think are very much in line with where a separate letter might bring great value along the lines of what Supervisor Wynn, there's a level of uniqueness, even though I think a San Joaquin Valley letter would be extremely helpful with our 8 Valley counties. But what I did want to ask Dr. Park, is there value of you knowing the position of the board that they would support us going more aggressively through phase 2 as part of your technical assistance conversation? Is there value in us getting a letter drafted from the board today so you have it in hand as part of your conversations tomorrow as part of your technical assistance discussion?
If that is the direction that the board would like to take, that I believe that would be helpful, so that I'm prepared to say what we all are ready to reveal to the state tomorrow, because I'm going to reveal to them this roadmap, the metrics that we've met, parts where we think that we meet it in spirit, and we'll go from there. So if we have a Valley letter and a board letter, whatever we have by end of day would be very helpful.
Is that something, Madam Chair and board members, you would be interested, and I will volunteer to draft that on this board's behalf and get it for all of your consideration, with, of course, assistance from my staff in the CAO's office. But if that would be, we would get something like that done and get it in the hands of Dr. Park, so it's part of her conversation tomorrow.
I think it's clear that we want to provide as much support as possible to putting our very best foot forward in being able to move ahead. And on a lot of those metrics, it's not just an all or nothing. On some of them, we are very close, and we have a concrete plan where we know we will be able, on the tracking and tracing, we will be able to meet that. So that really even goes beyond just the spirit, meeting the spirit of it. So I think we have a very strong application to put forward in terms of getting some technical assistance and then knowing how to move forward on behalf of our county. So I think the rest of the board is in agreement. We would provide that support to Dr. Park. Okay. I have one question left. Supervisor Patty?
Thank you, Madam Chair. And just along to that point, any support that Dr. Park does need, of course, we're all with it. I want to go over a couple of things with Ms. Cunningham and see if we can include this in what's being discussed. And I appreciate you looking at phase 3 to see what we can get in at the same time and work with. That's great. There are some parts in California that they're doing motorsports already, so I'm wondering how we might include that in San Joaquin County. Kids activities, martial arts, kids programs, I think is being asked about. Wineries, outdoor events, restaurants, outdoor seating would be nice to include. Perhaps that could be included in parts of phase 2 in some capacity. I'm a little bit confused how furniture, curbside pickup. I don't know how we can't have a furniture store open. If you're going to go buy a couch, you want to go sit in it before you say, I want to buy this. So I don't know how we can stretch the parameters of what we can do, but as to your point, if we can get to that phase 3 and show that we've got the dynamics of how to function and operate and show the willingness to do it here in the county, I think that would be a great message to Sacramento that, you are on top of it. These businesses have a buy-in and they have a program and protocol that we're ready for. I think it shows a great part to the argument of why we have the emergency declaration, which brings me to, through the chair, county council, are just revisiting the emergency declaration as I started in the earlier discussion. Government Code Section 8625C. Are you familiar with it at all? I know because we talked about it prior. And the only reason why I ask is you had suggested, and as it's discussed today, that we might want to make a regional coalition and maybe reach out to other county councils and see if we want to put together language that might bond us so that when we do go to the governor, we are talking about regional, which might be a stronger message to get through some of the ideas that they're dealing with, just like we are, and the ideas that we can maybe move forward unilaterally in a stronger voice versus a standalone county in the center of the state here. There's a lot of frustration. We're all echoing. This is the echo chamber. We all have the same frustration. I think, Dr. Park, I understand you told me quite recent that we really want more local control. We can do more with local control versus hitting benchmarks that are just obstacles that if we don't get past those benchmarks, we're stuck and there's no way out of it. And I think we've got a problem here in San Joaquin County, as we've all identified, that we want to get out of this. We want to move forward, but we're not going to be allowed to. So we can put submissions, and I don't know how that conversation is going to go tomorrow. Maybe you can brief all of the supervisors afterwards if there's light at the end of the tunnel, or there's a pathway or a green light and we're moving forward, and we can start to share this with the citizens and the employees that are unemployed and the businesses that are struggling just to they're not even in existence. They're just on standby. So again, County Council, I'll maybe turn to you on that provision and see if there's anything what we could find in that government code that we might be able to bond with the region.
Question of bonding with the region is really a issue for the board's ability to connect with other, because it's Correct. A direction that it's not going to the county administrators and county councils, while we support the direction of the board, that passing of a resolution, whether it's on a one-off basis as Placer did or whether it's on a coalition basis, is really an activity that's going to have to be approved by the boards of supervisors.
Sure.
And as I stated earlier, we can certainly do, if it's the board's desire to do a resolution along the lines of what Placer County did, there's certainly the ability to do that. I think that what Placer was saying is that that their local authority is adequate. So it questions that 825 or 8625C, but if it's the direction of the board that you want me to draft a resolution along those lines, I'm happy to do that.
I would just venture to say that you may want to draft something to bring back to the board for consideration versus a week or 2 weeks from now we hit a brick wall and then we decide we may want a resolution. In the meantime, I've reached out to supervisors in Merced County and in Stanislaus. I've even been contacted by a supervisor from Fresno. So we may have a San Joaquin Valley alliance that may want to join in on this, because I'm sure our frustrations are their frustrations, and everybody might want to have a little more autonomy and local control. So I would venture to say I think it might behoove us to have something ready that if it facilitates Dr. Park and the county at some point to have a little more meat to the bones of what we're asking, and we have a regional coalition, it might be helpful.
I'll work on that.
Thank you.
Great, thank you. Dr. Park, I think this entire board has a lot of faith in your common sense that you're bringing to the process, and that we also understand that you're the one that's going to have to sign off on this, and that you're not going to sign something that you believe is untruthful or is unsafe for the people of San Joaquin County. I think what we want you to know is we want to provide every resource for you to make the very strongest case that you are comfortable making and can make on behalf of the folks here in San Joaquin County. We look at the numbers that you present to us, and what we see is very clear that we have flattened our curve, and we have worked really hard to do that, and it's holding. And so as we can move forward, I think we would like to be as forceful and as aggressive and assertive in terms of putting our best case forward. And the board is ready to provide you with the letters that you need, and we will work advocating with the other counties to help bolster those arguments. If we can cite the Johns Hopkins metrics as being an additional common sense approach to bolster what we're saying, if we can push forward changing those metrics for the more populated counties, we want to provide those resources for you. So thank you, and Ms. Cunningham, for putting together this and reading all of those protocols so carefully. I think it's going to be important that we have an understanding of what needs to happen so that as our businesses reopen, they are safe for themselves and for the public. So, and I think we have plenty of information to base that on.
I would agree with you that we're in a very good place on most of these metrics, and it's looking very good. So if you're going to be writing a letter, you need to focus on that very first measure with the prevalence, the stability measure.
Thank you. And Ms. Nino, we're going to look to you for that draft quickly. Are there any other questions for staff? Is there any other staff members here that have something that needs to come forward to the board? Okay. And I think we have provided direction. I'm going to turn to the clerk. Are there any additional public comments that we need to enter into the record?
Madam Chair, we've received approximately 25 additional comments prior to this discussion, and we also have the letter that you would like me to read into the record from Ms. Ransom.
Okay, go ahead, please.
Okay, the first comment is, look at all the facts. Yes, the virus is real and it is deadly. Staying inside and secluded is deadly by making everybody's immune system fragile. Things could heat up with everybody just going back to normal. Open up slowly and safely, but open. This is people's livelihoods on the line. If some want to stay home, let them, but give others their freedom to choose. This is what has made the U.S. the best country in the world, and that is by Rob Ryan. Deborah Spangle writes, I am a member of Lodi California Church, the home church with the pastor Tim Pollock since April 1981. They've played an important part in my husband and two sons' life. Now using mainstreaming to have services, we never stop. Please find the assembly of worship to be an essential event. I have received that. Thank you. God bless. Sincerely, Deborah Spangle.
Amen.
Jeff Ridge writes, perhaps it's time to reopen the state for comers and get the economy restarted. And Rhodesia Ransom's full comments to the board earlier this morning are, I am writing to implore you to look at the impact that COVID-19 has had on cities within your districts and consider their future fiscal health and sustainability post-COVID-19 before you vote on this item, referring to the CARES Act. I ask that you please provide an equitable allocation of funds to cities within your districts based on budget and population and actual losses to the city and within the city. Perhaps the county can keep 50% of the county and allocate the rest. San Joaquin County qualifies for COVID relief under the CARES Act because we have more than 500,000 residents who live in cities in your districts. The intent of the funding is to relieve the impact on the community and to cover unfunded expenditures related to COVID. The funding is supposed to be spent to relieve COVID impacts. The arbitrary allocation per supervisorial district is simply not fair. The staff report indicates a reserve for the hospital and only $8 million in losses across departments. That does not equate to $132 million because the remainder of the losses and impacts are in our city. Tracy alone is facing tens of millions in losses due to COVID-19. We need help recovering losses, restarting our local economies, and saving our small businesses from economic disaster. Furthermore, our cities in San Joaquin County are already delaying critical projects, struggling with structural budget deficits, and at least one city has recently recovered from bankruptcy. And then she lists the questions that we did read into the record, and she states, again, I ask that you help by working with the cities to use the CARES Act funding as it was intended. Respectfully, Rhodesia R. Ransom, Council Member, City of Tracy. The next comment is on behalf of the Lodi Swim Team, Lodi Water Polo, and Big Valley Water Polo. While I appreciate all the safety measures that have been put in place for the health and well-being of our children, families, and community members, I do believe that our children's health goes beyond COVID. Currently, 70 to 75% of the population is overweight or obese. Depression and anxiety among children and teens is at the highest level recorded in history the last 5 years. Exercise and physical activity has been shown to reduce stress, improve mental awareness, increase autoimmune system, reduce risk factors for chronic disease, and many other physical, mental, and emotional benefits. While team sports is not a requirement for healthy exercise, it is clearly evident our society is not motivated to participate in the recommended 60 minutes of intentional exercise a day. Furthermore, swimmers and water polo players need access to a pool for their unique sports. The science behind swimming and participating in water sports is not available to make a determination on the health risks of COVID. As a parent, I am writing to sign a liability form for my child to participate in water sports. I believe that some normalcy for children's mental, emotional, and physical health is more important than the possible risk of COVID. Signed, Heidi M. Plath. And Philip Diaz writes, I am writing to express my frustration at the local level, San Joaquin County and City of Lodi, in not taking your leadership roles with purpose. Each one of you is personally responsible for handcuffing businesses that can open today safely if action were taken sooner. Today, you can make up for a lack of response in acting rather than just reacting to what our governor advises. Our small businesses are very educated and can implement public safety requirements, but what we need is the backing of this board in order to open. The economic political impact is growing each and every day. You let this drag on without taking leadership to open our county. What we need is a call to action to let business owners and community decide what choices they want to make. Give us a choice, let businesses decide if they want to open, and let the public decide if they need to stay home. An anonymous writer writes, I understand that money is what is important to the people in this county. I would also like to remind everyone that the cases in this county are as low as they are because we followed guidance from public health officials. If we relax our guidance so quickly, we will see an uptick in infections that could potentially affect you and your families. I believe and have seen with the simplest guidelines that they are not being followed. I request that we continue to make informed decisions that are not for political benefit and follow public health recommendations, as not all of us believe that the government is trying to control us, but is doing the best that they can to guide us through protective measures. And another unsigned letter writes, people need to understand that the virus seemed to have flattened only because of the shelter-in-place protocols, and if they are removed, all numbers that people are saying are smaller will surge and increase. Hair and nails are not in the Constitution. Grateful that the virus hasn't reached my family, but I know it can. The fact that most people's concerns are only financial, which only indicates that our government did not and has not planned accordingly, is to take care of its people in an emergency such as this. Dan Tynan writes, this is killing small businesses the longer we keep them closed. Please, for all of small businesses out, please open back up. Molly Anala writes, hi, I just want to say that this is the most disgusted I've been in my entire life. What big box stores are open, small businesses are quickly dying. That means less tax revenue for the cities and the county. Are you all going to take a pay cut or not take a salary at all, like we are doing? It's easy to make decisions when you are not the one facing financial ruin. Why can't small businesses open and do the same safety protocols as the big box stores? They can. That's the whole hypocrisy of this thing. Just know that people are watching and will be out in force to vote this November. Something needs to be done, simply done, because you can't get blood from a turnip. Sincerely, Molly Anala. Caroline Alvarez writes, Dear Supervisory Committee, thank you for your hard work and for all you have done for us. Please allow us to go back to church soon. Ricardo R. Barron writes, as a longtime resident and property owner, I urge you to end the shutdown. Countless lives have been destroyed, more with every day that this insanity continues. Drew Cyrus writes, hello, my name is Andrew. Please relinquish local control to the county. Open the fairgrounds to activities like motorsports so people can practice their driving skills in a controlled environment with social distancing practices in effect. Thank you and have a wonderful day. I'm going stir crazy. Roz Lopez writes, I am writing to you to share my concerns about Stockton opening up amidst the COVID outbreak. My family has been sheltering in place since the onset of COVID. It's not easy, but we're doing it for ourselves and for our fellow members of our community. I realize many people are without work, and it's frightening. People are getting desperate. I do feel the federal level, the stimulus monies have not been appropriated properly, and had they been, this would not be as big an issue. But we, and I know you, cannot control that. However, as we open up, I hope you consider strongly putting in place rules that are mandated. I'm horrified going into the grocery stores and seeing people so close to me and not wearing masks. I'm horrified that all workers are not mandated to wear masks. In countries other than ours that have opened up, the numbers are rising again. Our numbers haven't even peaked yet. Please consider taking control of the situation so that all of us can feel safe venturing out into the world. Okay, another message here. This is from Pat Patrick, President CEO of the Lodi District Chamber of Commerce. It's a rather lengthy comment, so I'll try to summarize it. He writes, I attended the reopened San Joaquin County Business Rally on Saturday at Sherwood Mall Shopping Center. It was an orderly meeting. Supporters were made up of a cross-section of the people of San Joaquin County. Many were business owners and united in their desire to reopen their businesses. Supervisor Patty and many who spoke did not advocate for a careless or definitively risky reopening move. The data shows clearly the San Joaquin County curve has been flattened. I asked those in attendance if they had heard the phrase, we the people. Of course, they responded yes. As president of the Lodi Chamber, 85% of my members are small businesses. In a survey we did, confirmed by one that was nationwide, most of them can last about 3 months of being closed. We are almost at 2 months. We have to open now. Trust business owners to do the safe things in their businesses because they have everything on the line. Meredith Baxter, Executive Director of Community Partnership for Families of San Joaquin, writes, as a nonprofit partner, we have been tracking all COVID-19 activities since March 25th. Tracking activities should not be a surprise to any business or nonprofit. We have developed comprehensive guidelines for Phase 1 services and Phase 2 services. It is not possible to effectively serve people and meet our contract deliverables without a phased and safe opening to the public. In order to meet contract deliverables, nonprofits need clarity regarding reopening. When can we reopen to the public with safety precautions and resume in-person case management, tax assistance, and employment and training programs? Ms. Whisper Gray of Manteca writes, not only is it unconstitutional to pick and choose what businesses are open or not, we have bottlenecked people into large corporations, causing more exposure in the long run. This germ has been here at least from January, and we are not seeing the overwhelming death that was projected. Please get out of the way of people who need to work. Your paychecks also depend on the tax revenue. And Michael Renoja has submitted a letter regarding the unconstitutional lockdown of the county. Riza Phelps writes, Good morning. I'm listening to your meeting right now. It seems like it's more about the money and less about the lives needing to be saved. Have any of you been without income in the last 8 weeks, like many of us, waiting on the state to get unemployment together to actually send out fund, and yet many are still waiting? Will you be willing to go without income that you are asking the rest of us to do? Thank you. Lauren Kavanaugh writes, to whom it may concern, I ask for you to reopen our county with safety precautions. Small businesses that I regularly attend are having to permanently shut their doors as this quarantine has caused a huge loss of revenue. People are smart enough to decide for themselves whether or not they want to go to a business and out into public. So please open the county up and let people be free to make their own decisions and to support their families again. Kelly Brown, in response to the opening of the county waste facilities, writes, in listening the waste management person answer Mr. Nguyen, it is clear by closing this business and any other production business will create a huge burden initially. The longer the wait, the longer the burden. Pardon, but could we find a way to flatten the curve? The point I'm trying to make here, you are not only weakening the small businesses, mom and pops, but the whole supply chain surrounding them. Walmart has its own trucks, own supply chain, etc. So if you have 200 small businesses that you can see closed, how many more in the background are there? And can those in the background ever regroup to supply again? Like ever. One of those background businesses is government. Where does it anticipate getting tax dollars next year? And Stephanie Walea writes, I wanted to reach out to you in hopes of getting a better understanding of your decision to reopen some county departments to the public and not others. You have chosen to reopen county departments, including but not limited to the Treasurer Tax Collector's Office, to the public, and yet you have refrained from allowing the public back into your board meetings. To the family, friends, and loved ones of those county employees, it looks as if you are putting the board's safety over that of your own county employees. However, I am hoping that is not the case. I would greatly appreciate if you could please explain your thought process behind these decisions. Thank you for your time. I look forward to hearing back from you. And Leanne Turcotte writes, please contemplate this, sirs. We want to go back to church and be together. It's important that we be together in fellowship, please. Robert Ham writes, please reopen businesses and sporting events. I, as a citizen, want to support businesses and always have. My business is up and running, and we can all keep the economy going, including sporting events, and all businesses should be reopened. Meredith Baker writes, in regards to the no COVID-19 deaths for 14 days, how is San Joaquin County quantifying and qualifying COVID-19 deaths? For example, if someone dies in hospice and or end-of-life care and contracted COVID-19 prior to death, is that counted against us as a COVID-19 death during the 14-day period? And the last comment I have is from Angela Zakari, who writes, we have done our part. We stayed home to slow the curve, and the San Joaquin County hospitals were not overwhelmed at any point during this COVID-19 crisis. Please open up our county for our kids. Everything has been taken from them, and I am worried about their well-being. Schools, sports, friends, vacation, parks, celebrations for milestones, and achievements has all been taken away, and it's quite depressing for them. Please open up. The number of cases just do not justify the shutdown. Our businesses are suffering too much from this. I can see some regulations to make establishments safe for people to reopen, but the shutdown is too much and has been going on for too long. So please, for all of the people, open up, please. Thank you for your time. And that concludes the comments that we've received.
Thank you. Before we move on, I want to have County Council comment real quickly. The comment we received from, it sounds like an employee very concerned about why we had opened up certain departments within the county, but not these chambers. We actually had this discussion this week between the clerk of the board, yourself, and me in regards to when do we open up the chambers again. And so I just would like our employees to know that we have been thinking about this and trying to come up with what's the appropriate way to handle it. And I thought this would be the right time for you to weigh in on this.
Thank you. Through the chair, one of the things that we look at when we're making these changes is what are the activities that the governor has approved or the state has approved that are similar in nature to the activities that are occurring here. Supervisor Wynn spoke earlier today about the Johns Hopkins study and how one of the factors that it looks at is dwell time, or the length of the exposure, as far as the determination of risk, whether it's a low risk, medium risk, or a high risk. In most of the exchanges with people coming into the buildings, they're of a more limited duration, likely 30 minutes or less. Whereas these meetings go on for
a lot longer than
5
30
hours,
minutes.
right?
Yeah.
And so that is a big factor, and one of the reasons that I recommended that, because of the length of the meetings, even though we can socially distance, that although the building is being opened up to the public, that we not open up the meetings yet.
Okay, thank you. I just wanted the board also to be aware that those conversations. Supervisor Elliott?
Thank you, Chair. I was just informed that Mayor Rickman of Tracy had asked that his comment also be read in its entirety. So request that we do that as well.
At your pleasure, I can read his comment if you wish.
Okay, sure.
And I would point out, Madam Chair, that the Board of Supervisors office and the Clerk of the Board's office are open with the opening of the administration building, so members of the public are able to come to the Board of Supervisors offices as needed.
Great, thank you.
I'm sorry, can you hear me now? Is that better?
Yeah, that's
okay.
better.
Got it. My apologies. I was just clarifying that the Board of Supervisors offices are open along with the administration building, although the board meetings are not. So Robert Rickman's comments in their entirety are, today you will discuss the spending plan for the $132 million CARES Act funding, and I urge the Board of Supervisors to earmark a portion of the funding specifically for cities to be split based on population size. We all have experienced unforeseen expenses related to COVID-19 that we are dealing with. As a city, we have been on the front lines responding to the needs of our community. These responsibilities and expenses include, but are not limited to, overtime for our employees as we educate the public and businesses regarding the county and state public health orders, providing our public safety personnel with additional PPE gear, programs for our small businesses to help them through this difficult time, and the operation of our EOC Center 24/7 to ensure our community is safe and informed. Here is an example of the potential devastating impacts COVID-19 will have on our revenues as a city. Some initial estimates suggest that the city may see a 15 to 20% decrease in sales tax and TOT revenue over the prior year in the current fiscal year 2019-20. Order of magnitude can potentially be anywhere between 3 to 5 million over the next 3 to 5 months. This is in addition to the city's existing deficit of 4.7 million. If the COVID-19 emergency remains active and the stay-at-home order is extended, the city's revenue growth will be severely impacted, as will its ability to recover. At a minimum, the growth projected in sales tax, TOT, and property tax will not materialize in fiscal year 2021 through 2025. The city's deficit will double to 10 to 15 million over the short-term forecast. Thank you for taking the time to read my email. I urge the board to earmark a portion of the funding specifically for cities so that we can be able to weather this crisis as well. Sincerely, Robert Rickman, Mayor, City of Tracy.
Thank you. Okay,
Chair? Yeah, I have something to add.
Okay.
Thank you. And very briefly, to Mayor Rickman's point, and also we had the Stockton mayor said that our plan is to hoard the money in the county. And I don't think that's the case. I don't know, Ms. Nino, if you like, I think we've identified that the city is going to be able to apply for some funding. And I think it would be improper for anybody to assume that we're hoarding the money for the county. As I know, if the city were to be reimbursed, they wouldn't be reimbursing the county for its operating expenses.
That is very accurate, Supervisor Patty. What was said and what this board agreed to is that when I come back either the end of July or August, and we know what our actual costs are, and if the board wants at that time to reconsider how the monies are distributed, because say, for instance, and which would be a wonderful thing, if the county's costs are less than anticipated, the whole goal is that we're able to utilize the entire 132 million within the time frame. And in the event, as I shared with this board, City of Stockton is one of the large 13 cities, and it was shared with me on our CAO call on Friday that the 13 large cities did send a letter to the state of California to receive some of their direct allocation of stimulus dollars. So the county would not expect the cities to reimburse us for our costs. That is, I know in my career, that has never been what has happened. And also, the cities do have access to FEMA. That's why Office of Emergency Services has done a phenomenal job at the get-go to encourage all the cities to keep track of their costs so they can get reimbursed for their staff's overtime or additional PPE for their various fire departments. So there is access to other funds. And a good example also, for instance, with the room key funding, that was SB 89 funding, and the City of Stockton received $1 million, which exceeded the amount either the county or the continuum of care received in regards to room key. And that room key effort was very much led out of San Joaquin County. So hopefully that clarifies. But when we do come back, the board can give us direction at that time if they would choose to address some of the city's needs or requests.
So basically 60 days from now, we'll be reevaluating and not just throwing the money out right away.
You are correct. But at this time, I did ask the board to give us the authority to reimburse our county expenses, in particular our hospital and healthcare services, and also meet whatever metrics that will adhere us to opening San Joaquin County sooner rather than later, especially that contact tracing.
Understood. It seems responsible. I appreciate what we all discussed today and where we got there. I think it's irresponsible to say that we're hoarding the money. And so I appreciate the work that we all did today. Thanks.
And I thank the Madam Chair and this board for taking action today, because especially getting the money out to our various businesses and healthcare partners sooner rather than later. And that's why staff are working very diligent to get those guidelines out for that additional 15 million to go towards each one of your districts, which does include city businesses.
Yeah, it's hard for me to understand the argument that we're not providing any assistance to the small businesses. Just because it's not coming directly from the city doesn't mean we're not providing direct assistance to the small business. That's the whole purpose of the $15 million that's going to be distributed. And we've heard we're going to get guidelines back very quickly on that, with the sole purpose of getting those dollars out as soon as possible for small businesses throughout San Joaquin County. So,
thank you for allowing me to respond.
Just a quick question. This money is targeted for reimbursable business interruptions, it says in the staff report, which may include cities, obviously, but that's really the focus. But businesses, I am assuming there are other programs in regards to reimbursement, certainly for cities through FEMA and other programs. And those usually, and Private Lima would know better, but those programs are usually targeted for the same type of activities that are costing or expenditures for cities. So I'm sure each city is documenting their expenditures and then applying. So in many cases, the money that they're asking that we supply, which would go to COVID-19 type activities, may be reimbursed through another means, which means that we will. I'm not saying we're not going to do that. We're just saying that we're going to wait and reevaluate. And certainly in the same period of time, they'll have the opportunity to see what funds they'll receive from other programs. So I don't think we're shutting them down or telling them no. We're just saying it's an evolving process, and we'll look at it in the future.
And as I shared with this board, if the restrictions allows greater flexibility, I will be back and correspond with this board prior to 60 days from now, or the end of July, beginning of August, because I would hope that the U.S. Treasury, they've done some great FAQs, and as you heard from CAO staff, we get something weekly from them. And as fast as OES assisted me greatly in applying for the money, we had 5 days. It was a 5-day turnaround. And we will, and thank you to this board for being so flexible. I very much appreciate it. It allows all of us to do our job more effectively.
And correct me if I'm wrong, but doesn't the CARES Act funding specifically exclude reimbursing for expenses that are available to be reimbursed through other programs?
It does say that, but it also gives you some flexibility. Of course, they do not want you to double dip.
That's my point.
So you are very accurate, Madam Chair.
Yeah, thank you. Okay, I'm going to turn to County Council now and ask to please announce items for closed session.
Board will meet in closed session on the item listed on the agenda. There are no announcements expected coming out of closed session.
Okay, then we are going to adjourn to closed session, and we will return here on Tuesday, May 19th at 9 a.m. We're adjourned. Thank you.